Hello friends, let us now discuss the anatomy of middle ear. So we have already discussed the anatomy of external ear. We have seen the EAC, we have seen the pinna. We have also discussed the tympanic membrane. So now we know tympanic membrane, it forms the lateral wall of middle ear. It is a part of middle ear. But as I told you earlier also, it's easy to understand the anatomy of tympanic membrane along with the anatomy of EAC. So that part I have already discussed with you. Now, before I start with the anatomy of middle ear, I want to discuss a term with you, and the term is middle ear cleft. Okay, so what do we mean by middle ear cleft? You see, middle ear cleft means middle ear plus mastoid. So we have already discussed mastoid. So that's the process or part of the temporal bone. Okay, so I've already talked about mastoid in the osteology, the very first topic, the fundamentals of the ear. All right, and plus the eustachian tube. So middle ear cleft, middle ear plus mastoid plus eustachian tube. All right, now middle ear volume is 1 ml. Mastoid volume is 5 ml. The eustachian tube, we know it is closed at rest. So we don't consider any volume for eustachian tube. So total middle ear volume therefore is 6 ml. All right. So middle ear cleft volume 6 ml. Middle ear 1 ml. Mastoid 5 ml. Now you can see over here the middle ear is communicating to mastoid with an opening. This opening is known as editus. So editus is the opening between the middle ear and the mastoid. Anything else that is important over here? Remember the largest ear cell of mastoid. That's known as mastoid antrum. Okay, so you see this editus is actually opening into the mastoid antrum. All right, so with this knowledge we come back to this diagram of the middle ear. Now we have already discussed the tympanic membrane. Now just look at this tympanic membrane. This tympanic membrane, you see, it divides the middle ear cavity into 3 parts. The part above the tympanic membrane, that's known as epitympanum. We can also call it as attic. You know what is attic? Attic is the uppermost part of the house. Okay, so over here attic is the epitympanum, the uppermost part of the middle ear. Then in front of the tympanic membrane, we have the mesotympanum. And below the tympanic membrane, there is a very small part that's known as hypotympanum. So 3 parts, epitympanum, mesotympanum and hypotympanum. Right? Okay. And the lateral wall of the middle ear is by tympanic membrane. But if you notice in this diagram, the lateral wall of epitympanum or attic, that's bony. So you see, this wall over here, this wall is bony. We call it as scutum. So somebody asks you what is scutum? Scutum is the lateral bony wall of attic or epitympanum. If you notice this scutum, it forms a bird beak appearance like this. Okay, and this scutum gets eroded. So this part that I am now encircling, okay, this part over here, it gets eroded when in cholesteatoma. So you can see it on a CT scan in cholesteatoma. All right. So erosion of scutum is a characteristic CT scan finding. All right. It's a characteristic CT scan finding in cholesteatoma. If somebody asks you which kind of cholesteatoma, you can even say primary acquired cholesteatoma. Okay, so what is cholesteatoma? What is primary acquired cholesteatoma? This all we will discuss later in the diseases, but just for you, you should know that this erosion of scutum, this part, this bird beak appearance is lost, and we see it on a CT scan in a case of primary acquired cholesteatoma. All right, now that was the lateral wall. Let's come to the roof of the middle ear. Now you see this roof, again this plate is a bony plate. And this plate, you can see over here, it separates the middle ear from the brain, middle cranial fossa. Okay, so this plate of bone is known as tegmen. Remember, the middle cranial fossa has the brain. The brain is lined by meninges, right? So the brain is lined by meninges, and the outermost meninge is dura mater. All right, so this plate of bone is just adjacent to the dura mater. Therefore, tegmen is also known as dural plate. Right? So now we know that this superior wall of the middle ear, that's known as tegmen, that plate of bone is known as tegmen, and we can also call it as dural plate. All right, now let's go back to this diagram of the middle ear cleft that we just studied. You see, when I talk about tegmen, the tegmen is in fact the complete plate of bone that covers not only the middle ear but also the mastoid. Right? So this whole plate of bone is known as tegmen or dural plate. Now, the part that is specifically over the middle ear, that is known as tegmen tympani. Right? And the part that is above the mastoid, you see, we have the antrum over here, uppermost cell over here. So just above that, we have the dural plate. So this plate is now known as tegmen enteri. Right? So tegmen tympani, tegmen enteri. One thing more over here, we just saw that the middle ear we can divide into three parts, that is epitympanum, mesotympanum and hypotympanum. Epitympanum is also known as attic. So I told you that this editus, it connects middle ear to mastoid. You can also go specific. It connects attic to antrum. Okay, so sometimes together we call it as attic ad antrum. So that is the entire unit. Attic ad is short form for editus. So attic ad antrum, that's the entire unit called, because all the three are connected. Right? Okay. Now let's go back to this diagram. So we have seen the lateral wall. We are now seeing the superior wall or the roof. But if you look at this tegmen, this plate of bone is not flat like this. Is it flat? No, it's not flat. It's protruding up at this point. This protrusion is known as arcuate eminence. Okay, and what is pushing it up? The superior semicircular canal. So you see over here, the superior semicircular canal is pushing the arcuate eminence up. And what is the significance of this arcuate eminence? This is an important surgical landmark. Okay, so arcuate eminence, this is an important surgical landmark for the nerve surgery. Suppose you want to do a surgery of the facial nerve or of a tumor of the eighth nerve. So sometimes we use an approach where we don't want to touch the middle ear or even the inner ear, and we want to directly reach the nerves. So what we can do is we can go directly like this. We can go from the cranial cavity, from the middle cranial fossa. So you do a craniotomy, you make an opening over here, you push the brain up along with its meninges. You can just push it up, you can retract it up, and then you go straight to where the nerves are. Okay, so this approach is known as middle cranial fossa approach. I know this approach looks scary because to operate on the ear, you are going through the middle cranial fossa. But in fact, this is a conservative approach. Why? Because you are not opening the brain. You are not even opening the meninges. You are just retracting it gently to one side, and you are saving the functions of middle ear and inner ear. You are directly reaching at the source of the problem. Okay, so this is known as middle cranial fossa approach. It comes in one of the conservative approaches for operating a tumor or some other problem in the facial nerve or on the eighth nerve. Right? Okay, now we have seen the lateral wall, we have seen the superior wall or the roof. We can see that there is a medial wall, there is a floor. Similarly, there is an anterior wall, there is a posterior wall. So this middle ear is actually like a box. Okay, so before we go forward, let's discuss the middle ear like a box, right? So let's go and discuss the box model of middle ear. Now, in this box model of the middle ear, we have seen the lateral wall. Okay, so what is on the lateral wall? On the lateral wall, we have the tympanic membrane. We have discussed the tympanic membrane in the previous topic. Then in the upper part, the lateral wall of the epitympanum or attic, we have the scutum. The superior wall, we have the tegmen tympani. Let's come to the anterior wall. Now on the anterior wall, we have two openings. Which two opening? We have a upper small opening, that's the opening for canal of tensor tympani. Okay, so this is the opening for canal of tensor tympani muscle, right? And we have a lower big opening. Now this lower big opening is the opening for eustachian tube. Eustachian tube is also known as auditory tube. We can also call it as pharyngotympanic tube because it connects the tympanic cavity, that means our middle ear, to the pharynx, to the nasopharynx. So we'll talk about this eustachian tube in some time, right? So there are two openings in the anterior wall, a bigger lower opening, that is the opening for eustachian tube, and an upper small opening, that is the opening for canal of tensor tympani. Right? Now we are able to see the three walls, but we are not able to see the remaining three walls. Why? Because right now this box is closed. So we need to open this box. Okay, we need to open this box. So how can we open this box? So what I'm going to do is, I'm going to take this lateral wall and I'm going to open it like this. Okay, so I'm going to rotate this like this. Is that all right? Okay, so I'm going to open and rotate the lateral wall. So you see over here, this is the diagram. I have rotated the lateral wall from here to here. Okay, I have opened up. What we can see, right in front of us is the medial wall. We can see the anterior wall, we can see the posterior wall. This of course is the lateral wall, and then above them over here we have the roof, and over here we have the floor, right? Okay, let us start our discussion first with the anterior wall. So anterior wall I have already discussed with you. How many openings? We have right now seen only two openings. Which two openings? There is an opening for canal of tensor tympani and there is an opening for eustachian tube. All right. Now let's come to the medial wall. Now on the medial wall you can see that there are two windows. Which two windows? Number one, we have the oval window. Oval window you can also call as fenestra vestibuli. Okay, remember this is a window. Windows are covered. So this window, it is covered by stapes footplate. Okay, right? Next we have the round window. The round window is also known as fenestra cochleae. It is covered by secondary tympanic membrane. Right? So both the windows are covered. Remember, openings are open, windows are covered. So oval window covered by footplate of stapes. Round window covered by secondary tympanic membrane. Alright. Now anterior to the oval window, you can see that we have a hook-like structure. Now this hook-like structure over here, which I have now encircled, this hook-like structure is known as processus cochleariformis. Okay, so this structure is known as processus cochleariformis. Now what is the function of processus cochleariformis? You see, we know that on the anterior wall we have a canal for tensor tympani. Okay, so we have this opening over here in the anterior wall. Now from this comes the tensor tympani muscle. So you see this tensor tympani muscle, now I am drawing this tensor tympani muscle. It comes from the anterior wall and it goes to the processus cochleariformis. Right? And at the processus cochleariformis, it takes a turn. So let's say this over here is the anterior wall. Okay, so we have the anterior wall, we have the medial wall, we have the posterior wall. So as you can see in the diagram, we have the anterior wall, we have the medial wall, we have the posterior wall. Now from here comes the tensor tympani muscle. So you see, this tensor tympani muscle is coming from the anterior wall and it is going to the medial wall. Okay, and at the medial wall there is a hook. There is a hook over here. Okay, so this hook is known as processus cochleariformis. Okay, so this hook is like this. The tensor tympani muscle comes, it hooks around processus cochleariformis, takes a turn, and now it goes and attaches to the handle of malleus. Okay, so this hook, processus cochleariformis, it's a hook for which muscle? Tensor tympani muscle. All right, okay, so remember, anterior wall, we have the tensor tympani, goes to the medial wall, takes a turn at processus cochleariformis, goes and attaches to the handle of malleus. All right, okay, next structure that we can see very clearly on the medial wall is this yellow colored structure. So that cord-like structure that we can see over here, that is known as facial nerve. Okay, so this is the facial nerve. Which segment of facial nerve? The horizontal segment of facial nerve, that's also known as tympanic segment of facial nerve. Right? So horizontal or tympanic segment of facial nerve. Now just remember one thing. The facial nerve over here, we can see in this diagram, but in reality, when you look inside the middle ear, you will not see the facial nerve. Why? Because this middle ear is in the temporal bone. Inside the temporal bone, the facial nerve, it travels in its bony canal. Right? The name of that bony canal is fallopian canal. Okay? So what we will see is canal all around it. There will be a shell of bone. This nerve will be encased in a bony canal known as fallopian canal. Remember, fallopian canal, this is the longest bony canal. This is the longest bony canal for any cranial nerve. Okay, and the length of this bony canal is 27 millimeters. Right, this segment, the horizontal segment, is actually inside the temporal bone, so you can also call it as intratemporal segment of facial nerve. I will be talking about the facial nerve separately in a separate topic, just to tell you that this is known as intratemporal segment of facial nerve, and this whole intratemporal segment is in the bony canal known as fallopian canal, and the length of that canal is 27 millimeters. Longest bony canal for any cranial nerve. Right? Okay. Now above this facial nerve, you can see a structure over here. This structure over here, this is known as dome of lateral semicircular canal. So you see, there are three semicircular canals. One semicircular canal we saw was the superior. It is going up, of course. So it is going up and it forms a bulge on the tegmen that is known as arcuate eminence. Now the lateral canal is coming out. Okay, the lateral canal, you see, it is coming out. So this bulge is seen on the medial wall of the middle ear. Okay, this bulge is seen on the medial wall of the middle ear. It is known as dome. Dome means the upper curve. All right, so dome of semicircular canal, lateral semicircular canal. Now important MCQ over here. This is the most common site for labyrinthine fistula, right? So somebody asks you most common site for labyrinthine fistula, answer is dome of lateral semicircular canal. All right, okay. Now we have seen all the structures on the medial wall, but there is something important about medial wall. What is important? You see, right now we are having a box model of the middle ear. Okay, so when I drew this box model, I drew the medial wall as flat. But the medial wall is not flat. the medial wall bulges out like this. Okay, it bulges out like this. Now this bulge on the medial wall is known as promontory. Okay, this is known as promontory, and it is because of the basal turn of cochlea. To understand this, let's go to a previous diagram. So we have come to this diagram once again, and what do you see over here? You see this is the medial wall, and in this medial wall you can see over here that the cochlea, which part of cochlea? Basal turn of cochlea, or the first turn of cochlea, is pushing the medial wall of middle ear outside. So this bulge over here, this bulge is known as promontory. All right, this bulge is known as promontory. Now if you notice one more thing, in the previous topic I told you that the tympanic membrane is pulled in like this by the handle of malleus. Okay, now I have just told you that the medial wall is pushed out like this. Okay, so you can see because of this the middle ear shape has become like a dumbbell shaped. Okay, so let's go to this diagram. So now when you look at this diagram, you can see that this part of the middle ear, which part? The mesotympanum, this has become the narrowest part of the middle ear. So this question comes in the exam, narrowest part of the middle ear, answer is mesotympanum, and this is only 2 millimeters. Okay, so you see this mesotympanum, it is only 2 millimeters. Okay, in comparison, if you see the epitympanum is almost 6 millimeter and the hypotympanum is 4 millimeter. So the narrowest part of the middle ear is mesotympanum. All right, now let's say you want to operate on a patient. Okay, so this position, this is your anatomical position. Okay, let's say I'm standing over here. All right, so this is my lateral wall. This hand is my lateral wall. This hand, let's say, is my medial wall. In between them we have some distance. Okay, this distance is minimum at mesotympanum. The distance is 2 millimeters, the narrowest part of the middle ear. This is the anatomical position. Now I want to operate on this patient. Of course, I cannot operate with him standing, so I have to make the patient go supine. So I make the patient go supine, and I have to operate on this ear, so I also have to turn the head like this. Okay, so when I turn the head like this, now what happens? You look at my pen. Earlier it was like this. Now I was calling it as the width. Now when I turn the head like this, now what has happened to this pen? It has become the depth or the height. Okay, you can call it either ways. You can call it as the height. I prefer to call it as depth. Why? Why? Because this is the, remember, this is the lateral wall, the tympanic membrane. I will be operating like this. So for me, this is the depth. Means the same thing. You measure from up to down, it is depth. You measure from down to up, it is height. Okay, so this is the depth of the middle ear. Now if somebody asks you which is the shallowest part of the middle ear in surgical position, means the same thing. You see, narrowest part of middle ear, it is implied the examiner is asking the anatomical position. Now the examiner asks the same thing, shallowest part of middle ear in surgical position. Answer is still same, it is mesotympanum 2 millimeters. Okay, the shallowest part of the middle ear in surgical position is mesotympanum. Now sometimes the examiner may not specify that this is the surgical position. He just gives you a question, shallowest part of middle ear, and he forgets to specify that it is anatomical position or it is your surgical position. Now what will you do? Now you will look at the choices. Okay, if the choices say epitympanum, mesotympanum, hypotympanum, you see those are the width. Epitympanum, mesotympanum, hypotympanum. But he is talking about the depth, shallowest part. So that means he is automatically considering the surgical position. Okay, so the narrowest part is the mesotympanum. The other dimensions you can see are 15 millimeter. The actual height of the middle ear in the anatomical position, that's 15 millimeter. So the narrowest part anyways in any dimensions is the mesotympanum, that is 2 millimeters. Okay, let's go back to the box model. So we come back to our open box model of the middle ear. We have seen the medial wall of the middle ear. Let's go and look at the posterior wall. Okay, so now we come to the posterior wall of the middle ear. Now the posterior wall of the middle ear, remember this is the common wall between the middle ear and the mastoid. And as we discussed some time back, that in between them there is an opening. This opening is known as edictus. Edictus is the opening between middle ear and mastoid. If we want to specify, we can say that this is the opening between epitympanum and antrum. Okay, etic and antrum. All right. Now, what else can we see on the posterior wall? You can see this nerve coming. This is the facial nerve. Once again. Now, this is the vertical segment of facial nerve. It is also known as mastoid segment. Remember, this wall is common wall. So, this segment can also be seen through the mastoid. So, it is also known as mastoid segment. Right? Now, there is a branch coming out from this nerve. What is that branch? This branch comes out from the facial nerve. It enters into the middle ear from the posterior wall. Okay, so as you can see, it enters into the middle ear from the posterior wall. It hangs in the middle ear like a cord, like a rope. Okay, and then it exits the middle ear from the anterior wall. Okay, this branch or this nerve which hangs in the middle ear like a cord is known as chorda tympani. Okay, hangs in the middle ear tympanic cavity like a cord. So chorda tympani. Right? It exits the middle ear from the anterior wall through an opening that is known as canal of Hoogier. Okay, so this is known as canal of Hoogier. This is the third opening in the anterior wall. So previously I taught you only two openings, canal for tensor tympani and eustachian tube. This is the third opening, canal for chorda tympani. That's known as canal of Hoogier. All right. Okay. Now, in the diagram, you can see that this branch is shown going in the opposite direction. Yes, that is also correct. Now, why that's correct? Remember, in the very beginning of studying this diagram, I told you I have opened the lateral wall like this. So once I rotate this lateral wall and put it back to its original place, this nerve will come exactly the way I have just shown you. Right? Okay. So remember this nerve, this branch of the facial nerve known as chorda tympani, it goes across the middle ear from the posterior wall to anterior wall. In fact, you can see that it goes between the malleus and the incus. Okay, it is actually lateral to incus but medial to the malleus, and it goes to the anterior wall where it goes out. All right. Now, what else can we see on the posterior wall? On this posterior wall, you can see a structure which looks like a pyramid. This is actually named as pyramid because it looks like a pyramid, so we named it as pyramid. Now, on this pyramid, what is the significance of this pyramid? On this pyramid, we have a muscle. So from this pyramid, this muscle comes and it goes forward and attaches to the smallest bone in the body, that is your stapes. So I think you have all guessed the name of this muscle. This is your stapedius muscle. This is the smallest named muscle in the body, stapedius, and it is attached to the smallest bone, that is stapes in the body. Right? Okay. So this much anatomy of the posterior wall, I guess, is clear to everyone. Now let me show it on my hand. Let's say this is the posterior wall. Okay. So my hand over here, this is the posterior wall. On this posterior wall, I hold the pen. So let's say this pen is the facial nerve. Which segment? This is the mastoid segment or the vertical segment of facial nerve. Right? Okay. So we have the posterior wall. We have the vertical or the mastoid segment of facial nerve. Now this over here for you guys, this is the medial wall. Right? Now, on the facial nerve, you can see on the posterior wall, because of this facial nerve, we have two parts. We have two areas. One area lateral to the facial nerve and one area which is medial to facial nerve. Now, if you are looking from there, okay, you are looking from there, or if I am operating in the middle ear from here, I am not able to see this area. Which area? The area that is medial to the facial nerve. Okay, so this area which is medial to the facial nerve, I am not able to see this area. This is the blind recess. Right? Okay, so I will do one thing. I will shade this area on the posterior wall. So this area, now I am shading in the green color. Okay, so this area that I have now shaded in the green color, this area is a blind recess. You are not able to see this area right now. Okay, and similarly as a surgeon, we are not able to see this area when we are operating on the middle ear because the facial nerve hides this area. This area is known as sinus tympani. Okay, so this area is known as sinus tympani. Now, I am going to mark another area. You see over here, I am marking this next area. This area is lateral to facial nerve. Okay, so you can see this area, it is lateral to facial nerve. Not just lateral to facial nerve, it is also above the cauda-facial angle. Okay, it is also above the cauda-facial angle. This area is known as facial recess. Okay, so this area which is lateral to the facial nerve, that is known as facial recess. All right. Okay, so now before we go forward, let us discuss the sinus tympani and the facial recess in detail. Okay, so we have marked two areas. I'll take you back. We have marked two areas. The number one area over here, which I am again shading for you in the green color, this area is the sinus tympani. Right? And the area that I'm shading for you in the red color over here, this is the facial recess. Okay, so what are the boundaries of sinus tympani? All right, so we'll first talk about sinus tympani. What are the boundaries of sinus tympani? Let's look at my hand. Very clear. What is the lateral boundary? You see, this is a space over here, okay, and it's a blind space, it's a blind recess. What is the lateral boundary? The lateral boundary you can see is the facial nerve, right? The lateral boundary is the facial nerve. What is the posterior boundary? The posterior boundary, of course, is the posterior wall, right? What is the medial boundary? The medial boundary is formed by the medial wall. Very clear? Okay, so we have three boundaries with us. We have the lateral boundary, we have the medial boundary, we have the posterior boundary. Now, what about superior boundary? Okay, now you see just below the oval window, from just below the oval window, we have a small ledge of bone that goes from the medial wall to posterior wall. This ledge of bone has been called as ponticulus. Okay, this has been called as ponticulus. This forms the superior boundary of sinus tympani. Similarly, just above the round window, we have another ledge of bone. This ledge of bone has been named as subiculum. Okay, and subiculum, it forms the lower boundary of sinus tympani. Right? Okay, and you can see that anteriorly this space is open. It is open into the posterior mesotympanum. All right, so that was our sinus tympani. Let's come to the facial recess. Let's come to facial recess. So, facial recess. What are the boundaries of facial recess? We have already seen two boundaries. You see, this is the facial nerve. So, what is the medial boundary of facial recess? Now, the facial nerve forms the medial boundary of facial recess. Okay, what is the lower boundary? The lower boundary is the cauda facial angle. Cauda tympani nerve comes from here. So, cauda facial angle, that forms the lower limit of the facial recess. Okay, what is the lateral boundary? Now, you see, this cauda is not here. It is the inferior boundary, it is not the lateral boundary. You see, the cauda goes like this. So, I have already told you, the cauda tympani nerve, it goes like this anteriorly. So, it is not there laterally. What is there laterally? Okay, just remember, when I will reposit the lateral wall. So, this is the lateral wall. When I reposit, so what will come laterally? Laterally, we will have the tympanic membrane. Which part of tympanic membrane? The periphery of the pars tensa. That means the annulus. Okay, so the lateral boundary of the facial recess is our annulus. Annulus of tympanic membrane. Okay, that's done. Now, what about the superior boundary? No. Superior boundary is not dural plate. Okay, superior boundary is not tegmen. There is something before tegmen that forms the superior boundary. Otherwise, I would have not asked this question. So, what is the superior boundary of the facial recess? Okay, for that, you have to have some three-dimensional orientation. So, I'll help you with that. You see, this is the malleus over here. We can see the malleus. We can see the incus. Okay, now this over here is the short process of incus. Okay, this is the short process. This part, that's the body of incus. Then we have the long process of incus. So anyways, we'll discuss that. But if I rotate the lateral wall and put it back to its position, so this short process of incus, it will also rotate and it will come over here like this. Okay, so what forms the superior boundary of facial recess? The superior boundary of facial recess, you see over here, is formed by the short process of incus. Now, place where the short process of incus is there, we call it as fossa incudis. We call it as fossa incudis. So, superior boundary of the facial recess, you can say short process of incus, or the better word to use is fossa incudis. Right? Okay. Now, what is the significance of sinus tympani and facial recess? So, as you can see over here, the sinus tympani, this is a blind recess. The sinus tympani, I told you, is a blind recess. So, therefore, if there is some disease in sinus tympani, we will not be able to remove the disease completely. Right? This disease we are not able to remove entirely. Okay? So, this is a blind recess where we are not able to remove the disease. So, therefore, what will happen? This is the most common site for recurrence or residual cholesteatoma. You are not able to see, so you are not able to clear. So, recurrent or residual cholesteatoma. Okay, right? Now, sinus tympani, most common site for recurrent or residual cholesteatoma. Okay, what about facial recess? Facial recess is the site for posterior tympanotomy. Tympanotomy means opening the middle ear. Posterior means behind. So you are opening the middle ear from behind the middle ear. Now what is behind the middle ear? Behind the middle ear is mastoid. That means you are opening the middle ear from mastoid. Okay, so if you go from mastoid process into middle ear, that's known as posterior tympanotomy, and you make this opening through facial recess. Okay, You make this opening through facial recess. All right. Now, we have discussed the sinus tympani. We have discussed the facial recess. We'll talk more about them later. Let's first go to the inferior wall, shall we? Okay. So we go to the inferior wall. Now, on the inferior wall, you can see that there are two vascular structures. Which two vascular structures? You can see there is jugular bulb and there is ICA. So now you see this inferior wall or the floor of the middle ear. This floor of the middle ear is a bony wall. And again, this wall is not flat. It curves around these vascular structures like this. It curves around these vascular structures like this, like the way I have drawn. So, because it curves around these vascular structures, it forms a crest between them. All right? This crest is between carotid artery and jugular bulb. So, this crest is known as keratico-jugular crest. Carotid artery and jugular vein or jugular bulb. Okay? So, keratico-jugular crest. Now let's look at this keratico-jugular crest in another diagram. So what we can see in this diagram? In this diagram, you can see the carotid sheath. Now from the carotid sheath comes the internal jugular vein and it has a jugular bulb over it, forms a jugular bulb just below the middle ear, just below the floor of the middle ear. We can also see the ICA. Okay, we can see over here this ICA going up, and there is a part which is below the floor of the middle ear. Now between the ICA and the jugular bulb, you can see a bony ledge that is known as keratico-jugular crest. Okay. Now suppose I have to see the two vascular structures. I want to see the ICA, I want to see the jugular bulb. What can I do? I can do a CT scan. Okay. Some special CT scan? Yes. I have to give a contrast. Okay, so I will give contrast, IV contrast. This IV contrast is in the blood, it will go in the ICA. From the ICA, it will also reach the jugular bulb. So both my vascular structures have the radiopaque contrast. Now when I do a contrast enhanced CT scan, I can see both of these vascular structures. Alright, how will I identify which is ICA and which is jugular bulb? Very easy. What is anterior to this keratico-jugular crest? Remember in CT scan you can see the bone. So what is anterior to the keratico-jugular crest is your ICA. What is posterior to the keratico-jugular crest is your jugular bulb. Right? Okay. So anterior to keratico-jugular crest is ICA. Posterior to keratico-jugular crest is jugular bulb, or you can say the IJV. Okay. Internal jugular vein. Now let's say there is a tumor of the jugular bulb. Alright, there's a tumor of the jugular bulb. Now what happens? Now because of this tumor, what happens? What do you see over here? This crest is gone. This crest is eroded. So now what happens? This whole crest, you see, this whole crest is gone. So now the two vascular structures, they are lying absolutely close to each other. And if you give a contrast, both of them will have the contrast. So can you differentiate between the two vascular structures on CT scan? No, you cannot. You cannot differentiate between them now. Okay, so this is known as Phelps sign. Alright, this is known as Phelps sign. What is Phelps sign? Phelps sign is inability to distinguish between carotid artery and jugular vein or jugular bulb. Okay, inability to distinguish between carotid artery and jugular bulb due to erosion of keratico-jugular crest. And this Phelps sign, it is seen in contrast enhanced CT scan of glomus tumor. Okay, so remember glomus tumor, we have the contrast enhanced CT scan, and in that contrast enhanced CT scan we have a sign known as Phelps sign. Okay, right? What is Phelps sign? Once again, inability to distinguish between carotid artery and jugular vein due to erosion of keraticojugular crest. All right. So after understanding all this anatomy, let's go a little back. Let's talk about the sinus tympani. So we were discussing about the sinus tympani. What is this sinus tympani? As I told you, this sinus tympani is a space. Okay, it's a three-dimensional space. We have already seen this space. We have discussed with my hand model. Okay, medial to the facial nerve. Right? We have also discussed the boundaries. Now this is the time. Let's look at each of these boundaries. All right. So now number one, identify the structures. We can see the stapes. You can see the stapes foot plate. So where we have the foot plate, that is the oval window. Right? Okay. Then you can see the round window. Right? Okay. So just below the oval window, you can see that round window. What else you can see? You can see the facial nerve. You can see the horizontal segment of facial nerve taking a turn and now becoming the vertical or the mastoid segment of facial nerve. You can also see on the posterior wall that there is pyramid, and from the pyramid we have a muscle coming out, that is your stapedius. Anyways, the point, the space that I want to discuss over here, okay, the space over here is marked in the green color, that is your sinus tympani. Now just below the oval window, you can see from promontory there is a ledge of bone going to the posterior wall, that is known as ponticulus. Okay. Similarly, just above the round window, you can see that there is a ledge of bone which is going to the posterior wall, and that is known as subiculum. Okay. And this space is the sinus tympani. So once again, let me revise for you what are the boundaries of this sinus tympani. The lateral boundary, we can see the lateral boundary is the facial nerve. The medial boundary is the medial wall. Okay, the posterior boundary is the posterior wall. Now the superior boundary, you can see the superior boundary is the ponticulus. Okay, so that's your superior boundary. And the inferior boundary, you can see, is the subiculum. As I told you, the sinus tympani, this is a blind recess. Okay, and this is therefore the most common site for recurrence or residual cholesteatoma. What you cannot see, you cannot remove the disease from there. So if the disease is in the sinus tympani, it becomes very difficult for a surgeon to remove it. Okay, now let's look at this photograph. All right, now what do we see in this photograph? So this is the photograph of the middle ear. Now in this photograph, this is how it looks like when you're looking from a microscope. Now what do you see over here? What is this? This is your stapes. Okay, so that is your stapes, right? And you can see over here, that's the oval window. That's the foot plate standing on the oval window. You can identify the stapedius muscle. You can see the pyramid, right? Okay, guys, this over here is the round window. This is the promontory. Okay, so in fact this hole is the promontory, right? Now just below the oval window, see very carefully, just below the oval window, you can see over here a ledge of bone going. Now this ledge of bone is your ponticulus. Okay, and this ledge of bone going just above the round window, this, guys, this is your subiculum. Okay, and this blind recess over here that you see, this blind recess, this is your sinus tympani. Okay, now this bone, this is a cadaveric bone. Let me show you same thing in a live patient. Okay, so that was a cadaveric bone, and now we have a live patient. Okay, so during surgery this photograph has been clicked, and what you can see over here, you can see over here that this is the incus. So in the cadaveric bone there was no incus. You could see the stapes head. This was the stapes head, but now there is incus, and incus is attached to the stapes. So ideally you should not be able to see the stapes head, right? Okay, this is the muscle. You can see this is the muscle over here, and it is coming from the pyramid. So which muscle is this? This is the stapedius muscle. Okay, and this over here we can see that this is the round window, right? Just above the round window, you can see that this is your subiculum. Okay, so that's your subiculum. Now, the ponticulus is not visible in this view right now because of the stapedius. So it is somewhere over here. You have to look very carefully, but this blind recess is visible to you. Okay, so I am hoping that everyone is able to identify that this blind recess is the sinus tympani. So I hope you can understand that this blind recess is a very restricted place. It's very difficult to approach and clear this space. Okay, so this is the most common site for recurrence or residual cholesteatoma. All right. Okay, so let us now see this diagram. Let us now come to this diagram. So this is an exercise for you. Okay, now let us identify each and every structure on this diagram. All right, now what is the first thing you are able to identify? You know why? Because this diagram can come in your exam and the examiner can put X, identify X over here. Okay, or he can say identify this is your X1, or he can say identify this structure, this is your X3, right? He can say identify this structure, this is your X2. So I'm marking different X anywhere. Now what is the first thing that you are able to identify? The first thing you can identify over here is the stapes bone, unique bone, just like a stirrup. Okay, so that is the one thing you can identify. So now you can see the stapes head, you can see the two cruras, you can see the foot plate. Now where is the foot plate of stapes? On the oval window. So if that's the oval window, that means which bone it is, which wall it is. This is the medial wall of the middle ear. Okay, that's the oval window, so that is the medial wall of middle ear. Right, now on the stapes you can see a muscle attached to it. Which muscle is that? That is of course your stapedius, and stapedius rises from pyramid. Okay, so that is your pyramid. Now pyramid is on which wall of middle ear? Pyramid is on posterior wall. So that, my friend, is the posterior wall where we have the pyramid. Okay, so I hope that much is clear to everyone. Now in the posterior wall we have a nerve, right? Everyone knows we have a nerve. Which nerve? So I have marked that as X2. You can see a nerve going through the posterior wall. Okay, so which nerve is that? That is your facial nerve. Somebody asks you which segment? So this is the vertical or the mastoid segment of facial nerve. All right. Okay, now there are two spaces. One is lateral to facial nerve, one is medial to facial nerve. Okay, right. Now what is medial to facial nerve? So the medial to facial nerve X1, that is your sinus tympani. Okay, and what is lateral to facial nerve? We know lateral to facial nerve, we have the facial recess, right? Okay, so we have seen all the structures. Anything is left? Yes, you can see over here, this structure is left. So what is this? So this is a branch of facial nerve. You see, it comes out of the posterior wall. Which branch? Cauda tympani. Right? So this is how you solve a question, that's an image-based question. You have to first identify the most identifiable feature of that diagram. And then you start correlating it one by one to other structures. Alright? So this is how you solve these kind of questions. The examiner can simply place the X anywhere, or he can mark it as A or B or C anywhere, and you should be able to identify each of these parts. All right, now let's go and study the anatomy of mastoid process. All right, we have discussed the middle ear. Let's discuss the mastoid process. So we have already discussed a little bit about the mastoid process. What all do we know about mastoid process? This is a cancellous bone. All right, it consists of a lot of air cells. The largest air cell is known as mastoid antrum. All right, let's look at this diagram of the mastoid. So what is there in this diagram of mastoid? All the air cells have been removed. This mastoid process, it has been opened. Okay, so the mastoid process you see has been opened surgically. All the air cells have been removed. Now what we can see the walls of the mastoid process. The superior wall of this mastoid process that we already know is known as tegmen or dural plate. You can even call it as tegmen anteri. We discussed that earlier. Okay, now let's look at the anterior wall of mastoid. Now see, the anterior wall of mastoid is same as posterior wall of middle ear. This is the common wall. What can you see in this common wall? In this common wall over here, you can see the facial nerve. Right? This facial nerve gives a branch over here. That branch is known as cauda tympani. Okay? Look carefully. Lateral to the facial nerve, above the cauda facial angle, we have a space over here. That space is known as facial recess. Okay? This space is known as facial recess. What do we do over here? We over here enter from this place to the middle ear. So it is known as posterior tympanotomy. Okay. Now, just behind the posterior wall of the mastoid, you can see a blue color structure. That is a dural venous sinus. Which sinus? This is the sigmoid sinus. Okay. Now, that means the posterior wall of the mastoid, that bony wall, is covering the sigmoid sinus. So therefore, this plate of bone is known as sinus plate. Okay. So posterior wall of the mastoid is known as sinus plate. Superior wall is known as tegmen or dural plate. In between them, we have an angle over here between the sinus plate and the dural plate. This angle is known as sinodural angle, also known as Sitley's angle. Okay, so angle between sinus plate and dural plate, sinodural angle or Sitley's angle. All right. Now, this is the anatomical position of the patient. Right now, we are looking at the mastoid process in the anatomical position. Suppose I turn this patient supine. I want to do a surgery. I want to open this mastoid. So what I do is I turn the patient supine. I turn the head like this. So now let me turn this diagram into supine position. This is how we look at the mastoid when we are operating. Okay. So we know that this is the superior wall. This is the posterior wall, the sinus plate. Okay. This was the tegmen, the dural plate. Okay. And this is the common wall, right? The anterior wall of mastoid, also known as posterior wall of middle ear. What do we have over here? We have the facial nerve. This facial nerve, you can see a branch coming out. This is your cauda tympani, right? Okay. And what else do we see? We can see over here, lateral to facial nerve, above the cauda facial angle, we have this place. If I drill over here, I will enter into the middle ear. Okay. So what is this place? This is your facial recess. Right? This is your facial recess. What is the lateral boundary of facial recess? The lateral boundary is the annulus. We cannot see from the mastoid part. Okay. What is the superior boundary? The superior boundary is the fossa incudis, where we have short process of incus. So you can see the short process of incus. Okay. And what is this blue color structure? That's a bulge. That blue color structure is your dome of lateral semicircular canal. Remember, in the middle ear anatomy, we discussed the dome of lateral semicircular canal. Okay, so that's a bulge. You see, the lateral semicircular canal is coming like this. It forms a dome. It forms a curve. A part of that dome is in the middle ear, and a part of that dome is in the antrum, in the mastoid process. Okay, so a part of the dome is in the middle ear, and a part of the dome is in the antrum, in the mastoid process. Okay, remember that. Let's look at this diagram. So that's a photograph for posterior tympanotomy. Okay, this photograph is showing you exactly what we were looking at in this diagram. Let me orient you once again. All right, so let me orient you. What you can see right in front of you over here, this is the tympanic membrane. So you can see that this is the EAC. Okay, right? This over here is the dural plate. That's also clear to you. Okay, this over here you can see the bluish tinge, that is your sinus plate. Just behind that we have the sigmoid sinus, and between the mastoid and the middle ear we of course have the common wall. Okay, now if you look at this common wall, you can see over here that there is this nerve going. Okay, so there is this nerve going, and that is your facial nerve. I have marked that nerve for you. There is a branch coming out of this which has been marked with an arrow. This is your cauda tympani nerve. Is that all right? Okay, and you can see a bulge over here. So a part of the bulge, if you notice, a part of the bulge is anterior, that is in the middle ear, and a part of the bulge is posterior, it is in the antrum. Okay, it is in the mastoid. So that is the dome of lateral semicircular canal, and above that you can see the short process of incus also. That place is known as fossa and cutis. Okay, so lateral to the facial nerve, right? So we have the facial nerve. Where is the facial nerve? This is the whole process part of the facial nerve. So lateral to this facial nerve, okay, above the cauda facial angle, okay, superior boundary is short process of incus. We drill, and when we drill, we make an opening, we enter into the middle ear. That's known as posterior tympanotomy. Okay, so posterior tympanotomy is entering into the middle ear from the mastoid process. Is that all right? Okay, now the use of this posterior tympanotomy I will be telling you in some time. In the next topic, I will be showing you this posterior tympanotomy and the use of this posterior tympanotomy, right? But for now, you can remember this posterior tympanotomy is done for cochlear implant. You can also use it for some middle ear implantable hearing aids. Okay, so this is what you can remember right now. Now, what you can see through the posterior tympanotomy, if you see over here, this is the round window visible. Okay, so let me erase everything, and you see through the posterior tympanotomy, I have encircled. This is the round window visible to you. Okay, and anterior to round window, you can see the promontory. Okay, sometimes you are also able to see the stapes and the incus. Okay, the stapes incus joint. So yes, we'll see more photographs for the posterior tympanotomy and we'll discuss more about it. Okay, now before I go forward, remember in the embryology I taught you about corner septum. So what is corner septum? Corner septum is persistent petrosquamous suture. Okay, now if this corner septum is present, I told you at that time, it becomes difficult for us to find the antrum. Why? Because antrum is hidden medial to corner septum. Corner septum is lateral to antrum. So suppose you have entered the antrum. How can you confirm that you are actually in the antrum? Because all that is bone. Okay, all that is bony structures. How do you identify that you have entered into the antrum? You identify that with the help of lateral semicircular canal. So this bulge of lateral semicircular canal, it will of course be present only in the medial wall of antrum. Okay, this bulge, when you look through microscope, you can see a little bit color change. This is ivory white. Okay, so this ivory white color and the bulge of the lateral semicircular canal help us identify that we have actually entered into the antrum and we have We are not at the corner septum. All right. Okay. So let's look at this photograph. So this photograph is still a nearer view, a more magnified view. You can clearly see over here the facial nerve. Okay. And you can see that this is the chorda tympani nerve, branch of facial nerve. Okay. You can see this opening which has been marked with a star. That is the posterior tympanotomy opening. All right. Okay. What else can you see? You can see a very good bulge of the lateral semicircular canal over here and a very small but yes visible incus for us. Okay. So in between them we have made an opening and we have entered into the middle ear. So this is your posterior tympanotomy. All right. So I hope that's clear to you. Let's go to this question. This question was asked in the AIIMS November 2017 exam. Which of the following represents lateral semicircular canal during cortical mastoidectomy? Okay. So we'll talk about cortical mastoidectomy, but they have used the same image and you can see over here the B structure I told you is the facial nerve, branch coming out of it D, that is the chorda tympani. Okay, the A over here is the incus and this is the lateral semicircular canal. Okay, so C is your lateral semicircular canal. Okay, so the answer was C over here. A similar question was also asked where you were asked to identify A and that was the short process of incus, or you can simply mark as incus as was given in the choice. So you see the examiner can shift. You can simply ask, what is A or what is D or what is B, or he can ask which of these is chorda tympani, okay, which of these is facial nerve, right? So you should be able to identify these structures on these diagrams, right? Let's go to this diagram of mastoid. Okay, what is different in this diagram than previous one? In this diagram, the middle ear part and the mastoid part both have been opened and they have been made as one single cavity. Anyways, right now I don't want to go into that discussion. We will go into that discussion when we will study the surgeries of the middle ear and mastoid. Okay, so when we'll study those surgeries, I talk about it. Right now, let's focus only on the mastoid part. Okay, so now we have discussed the superior wall of the mastoid. We have discussed the posterior wall of the mastoid. Let's look at the medial wall. When you look at the medial wall, you can see a triangle. This triangle is known as Trotman's triangle. So what are the boundaries of this triangle? First, let's discuss the boundaries. Okay, what is the posterior boundary? Posterior boundary we know is the sigmoid sinus. Anterior to sigmoid sinus we have the sinus plate, but right now I am not considering the bony boundary. I am just considering the soft tissue boundary. Okay, so posterior boundary is the sigmoid sinus. Why I am not considering sigmoid sinus anterior wall, that is the sinus plate, why I am not considering the sinus plate, I'll tell you in some time. Right, now the anterior boundary is the bony labyrinth, the inner ear. Okay, and the superior boundary. So superiorly what do we have? We have the tegmen, we have the dural plate, but we are not considering the bone over here. So we have the soft tissue. So what soft tissue we have? Of course we have the dura. Now over here a dural venous sinus passes. Okay, at this specific place a dural venous sinus passes. This dural venous sinus is known as superior petrosal sinus. It is on the other side. It is on the intracranial side. If I remove the bone, I will see the superior petrosal sinus over here. So this forms the superior boundary of Trotman's triangle. Okay, so Trotman's triangle, posterior boundary is sigmoid sinus, anterior boundary is bony labyrinth, superior boundary is superior petrosal sinus. All right, now what is the significance of Trotman's triangle? The significance of Trotman's triangle is that this is the place from where colostoma erodes the bone and then it enters into posterior cranial fossa. Okay, so this is the place for spread of colostoma to the posterior cranial fossa, Trotman's triangle. Okay, now because the colostoma is eroded the bone. All right. Therefore, when a surgeon is operating, he will not find the sinus plate or the dural plate. They would have been eroded. Okay, so therefore we have not considered the bone over here. We have considered the soft tissue, the sinus, sigmoid sinus and the superior petrosal sinus. Because between these two vascular structures, the surgeon has to operate and take out the colostoma sac. Okay, anteriorly we have the bony labyrinth. Remember, the bony labyrinth is the hardest bone in the body, formed from otic capsule by 14 ossification centers. Okay, and chondral bone. So therefore, even though sinus plate and the dural plate is eroded, the bony labyrinth, most of the cases is still intact, and therefore we have considered the bony labyrinth. So we have considered only the bony anterior boundary. The remaining two boundaries we have considered as soft tissue boundaries. Right? Okay. So that is your Trotman's triangle. Okay. So before we go ahead, let's discuss about the dural venous sinus. So you see, I'm talking about these dural venous sinus quite a lot in my lecture, and these are very important. Although these structures, they are in the brain, they are a part of neuroanatomy, but they are very important to understand the ear and its complications. So we'll discuss about these dural venous sinuses, right? So what are the dural venous sinuses? You see, sinuses means empty space. Now these empty spaces are filled with venous blood. So these are venous sinuses. And these venous sinuses are made by dura mater. So therefore, dural venous sinuses. All right. Now what happens? The brain. You see, the brain is covered by the dura mater, the different meninges. Okay, dura mater, pia mater, arachnoid mater. So now the dura mater is the outermost layer of the brain. So now we know the brain is having two hemispheres. There are two cerebrum. Okay, there are two cerebral hemispheres. So similarly, there are two cerebellar hemispheres. Now the dura is covering the cerebral hemispheres all around. All right, and when it meets in the center, you see the dura from the two sides, it fuses. It fuses to form the falx cerebri, as you can see in the diagram. The dura from the two sides fuses to form the falx cerebri. Similarly, the dura at the level of the cerebellum fuses to form the falx cerebelli. Between the cerebrum and the cerebellum, we have the tentorium cerebelli. Right? Okay. Now you see what happens when the dura from the two sides comes and meets. When it is meeting superiorly, there is a triangular space created over here. Okay. This triangular space over here is a space that gets filled with venous blood. So this space is formed by dura mater. It is filled with venous blood. This is a dural venous sinus. Okay. So what is the name of this sinus? This is your superior sagittal sinus. Right? Okay. Now, similarly, when this forms the falx cerebri, it separates at the level of corpus callosum. It separates. So when it separates, it forms another triangular space. So this triangular space is known as inferior sagittal sinus. Okay. Similarly, at the level of cerebellum, you see cerebellum between the two cerebellar hemispheres. Now what happens? There is formation of falx cerebelli. So therefore, another sinus is formed over here, and that is known as occipital sinus. So we have seen three sinus: the superior sagittal sinus, the inferior sagittal sinus, and the occipital sinus. Okay, so now what we'll do is we'll draw our own diagram and we'll study all these dural venous sinuses. Okay, and to make this interesting, to make you understand and remember this for a very long time, I have an interesting story. Right? So we'll study this in the form of a story. This is a hypothetical story. I made it myself. Okay, it is a family story. Right? So this family story, with this family story, we'll discuss it. Okay, and you can see over here I've drawn the cerebrum and the cerebellum. Okay, now we just saw that in the cerebrum, the dura of the two sides come and meet the forms the falx cerebri, and we have over here the superior sagittal sinus. Similarly, we also have the inferior sagittal sinus. Here we have the occipital sinus. Right? Okay, so I label each one of them. We have the superior sagittal sinus. We have the inferior sagittal sinus. We have over here the occipital sinus. Right? Okay, so as I was saying, we have an interesting way to remember it, and we will remember it like a family story. So, our family has three people. Which are the three people? Father, mother, and son. Who is the father? Father is your superior sagittal sinus. Okay, so father is superior sagittal sinus. Who's the mother? Now you see, father may be superior, but the mother is never inferior. Okay, so who's the mother? Mother is the occipital sinus. Right? So mother is the occipital sinus. And who is the son? The son, you see, takes the name of the father. So father was sagittal sinus, son is also sagittal sinus. Father is superior, son is inferior. Okay, so like John Junior, John Senior. Right? So this is our John Junior, or we can call it as inferior sagittal sinus. Right? Okay, so let's start the family history. Now, this inferior sagittal sinus, the son, he one day meets a very, very good looking girl. Okay, a great looking girl. Now, her name is Great Vein of Galen. Okay, so great looking girl, Great Vein of Galen, also known as Great Cerebral Vein. Okay, so also known as Great Cerebral Vein. So he looks at this girl, he immediately falls in love with this girl, and he decides that he will marry this girl. Okay, right? So Great Vein of Galen, great looking girl, all right, and he proposes her, she accepts, both of them get married. All right, so this is the love marriage, he gets married. Now what happens to this guy after marriage? You see, this guy, the inferior sagittal sinus, he was curved. If you look at him, his father was also curved. So you see, the son has taken the characteristics of the father. Father is curved, son is also curved. But what happens after marriage? After marriage, the characteristic of a man changes. So you see, now after marriage, he becomes straight. All right? So after marriage, this sinus, the inferior sagittal sinus, becomes straight. So now, therefore, we will call it as straight sinus. Okay, so we call it as straight sinus. So now you look over here, we have the superior sagittal sinus, we have the straight sinus, and we have the occipital sinus. All these three sinuses, they are draining at one place. This one place over here, this is known as confluence of sinuses. Okay, so this place where all the sinuses are coming, they are known as confluence of sinuses. Right? Now, this straight sinus, so straight sinus is the young couple that we have now. Okay, now this straight sinus, it has two children, two grandsons. Okay, now those two grandsons, they are born at the same time, so they are therefore twins. All right, so they have twins. So you see, from this confluence of sinuses, there arise two sinuses. Okay, both of them are twin, right? Both these sinuses, they are twins. They look like each other. They arise from the same point, the confluence of sinuses. Okay, so these are our grandchildren for this family. Now these grandchildren, they are like their father. So how was the father? Remember, father was straight. After marriage he became straight. Before marriage he was curved. So we won't consider that. After marriage this become straight. So because this has become straight, now the son will also look like the father. So father is straight, they are also straight, they go laterally. They go straight laterally. Okay, so because they go laterally straight, now they are known as lateral sinus or transverse sinus. Okay, so they are known as lateral sinus or transverse sinus. Okay, now you can say that straight means this guy is totally straight, he does not look at the girl. Curved was the naughty one, so he is not able to find a girl for himself. Okay, so straight. Now he is not able to find a girl, and now what will you do? So these lateral sinus or transverse sinus, these are two grandchildren. They are twins, one on each side. So because they are identical, I will be discussing only one of them. Right? And now these are straight. You see, straight can be considered as honest, who does not look at the girls. Curved one is the naughty one. So the curved one was able to find the girl, propose the girl. The straight one is not able to. Okay, so the lateral, the transverse sinus, these are the shy guys. They are not able to go to a girl, approach a girl and find a girl for themselves. So what we have to do? We have to do an arranged marriage for them. Okay, so the family decides to go for an arranged marriage. So what will this family do? The family will find another respectable family. Okay, see, they will not find a girl. Their first criteria is arranged marriage. First they find a good respected family. So what is the good respected family in the neighborhood? So in the neighborhood we have a good respected family, that is the family of cavernous sinus. So remember, cavernous sinus has a lot of respect. Okay, it demands a lot of respect. So we have this family of cavernous sinus. Right? This cavernous sinus is approached by the family of our sinuses. Right? And they ask the cavernous sinus that do you have a daughter? Remember, there are two cavernous sinus, one on each side of the pituitary gland, and there are two lateral or transverse sinuses. Right now we are discussing one lateral or transverse sinus. Both are identical. Alright, so this cavernous sinus is approached by the family and asked, do you have any daughter? So this cavernous sinus says, yes, I have two daughters. Okay, so I have how many daughters? Two daughters. A elder daughter and a younger daughter. Okay, the younger daughter is much more beautiful than the elder daughter. Alright, so with which sinus will you marry? Which daughter will you marry, the transverse sinus or the lateral sinus? You see, this is arranged marriage. It's not a love marriage. You don't have a choice. Okay, so now this is an arranged marriage. You cannot choose. The cavernous sinus has two daughters, elder and the younger one. But she says that elder daughter is the one that I would like to marry. So the elder daughter, her name is superior petrosal sinus. Okay, superior petrosal sinus. Right? So superior petrosal sinus is married to lateral or transverse sinus. So what happens after marriage? Remember, whether it's a arranged marriage or a love marriage, the end result is always same. Okay, so what happens to the guy? The characteristic of guy changes. Remember, earlier this guy was curved, inferior sagittal sinus. After marriage became straight. Okay, but this is lateral or transverse sinus. He's already straight. So what will happen to him? Now he becomes curved. Okay, so now he becomes curved. It curves like S-shaped curved. This is known as sigmoid sinus. So now this is known as sigmoid sinus. Right? Of course, the sigmoid sinus is not very happy with his marriage. You see, earlier he was straight, he was shy. Okay, he could not approach the girls. Now after marriage he has become curved, he's become naughty. Okay, and he's not happy with his marriage. So what will he do? He will have an extramarital affair. Okay, so extramarital affair with a girl who is a singer. Right? So extramarital affair, we have MS3 vein, EM, extramarital, EM, MS3. So we have MS3 vein. Right? So this MS3 vein comes from outside. It is not in the cranial cavity. So remember, you don't have extramarital affair near your family. You have it away. So this MS3 vein is on the surface of mastoid process. Okay. So from the surface of mastoid, this vein comes and it drains into sigmoid sinus. Okay, so this vein comes from the mastoid surface, drains into sigmoid sinus. Therefore, if sigmoid sinus is thrombosed, then this MS3 vein may also be thrombosed. Okay, and therefore there will be edema over mastoid. Okay, this edema over mastoid is known as Gressinger sign. Remember, I told you the girl is a singer. Okay, MS3 vein, extramarital affair, the girl is a singer. So the sign is Gressinger. Right? Now this sigmoid sinus, it forms a turn at the floor of the middle ear. Okay, it forms a turn at the floor of middle ear. That turn is known as jugular bulb. Okay, that turn is known as jugular bulb. We have already seen the jugular bulb. Now, this jugular bulb, after that, it crosses the jugular foramen. Okay, so remember, the cavernous sinus had another daughter. Okay, the cavernous sinus had another daughter, younger daughter. She was much more beautiful. Her name was inferior petrosal sinus. So the sigmoid sinus tells her that I actually wanted to marry you. Okay, she is very beautiful and he tells her that I actually wanted to marry you. But I was married to your elder daughter. Now let's run away and marry. Okay, so he convinces her, both of them elope. Okay, both of them run away. They cannot marry inside the cranial cavity, remember? Okay, so both of them now run away. They go outside. So where will they go? They go outside this jugular foramen. Right? And once they go out, they get married. Right? So once they go out, they get married. And now what happens? What happens? This guy, he was curved, second marriage. Now the result will be same once again. After marriage, characteristic changes. So he was curved and now he becomes straight. He is now known as internal jugular vein. Okay, you see, one marriage changes the characteristic, second marriage changes the whole man. He was a sinus, now he has become a vein. Not only become straight, but also become vein, go straight down into the neck. Okay, so that's the anatomy of these dural venous sinuses. Okay, so we have two internal jugular veins. They bring the blood from whole entire brain. Okay, from these various dural venous sinuses. Okay, I hope it is clear. Just a quick revision. Okay, we have three members in the family initially. Which three members? Superior sagittal sinus, father, mother, that is your occipital sinus, son, the inferior sagittal sinus. Son meets a girl, a great looking girl, great vein of Galen. Marries her, becomes straight. Alright, straight sinus. All these sinuses, they drain at confluence of sinuses. So from confluence of sinuses arise two grandsons, two twins. Okay, which two twins? Lateral or transverse sinus, right and left. And the lateral or transverse sinus is married, arranged marriage, to superior petrosal sinus, daughter of cavernous sinus, becomes curved sigmoid sinus. Okay, now the sigmoid sinus has an extramarital affair with MS3 vein. Sign, Gressinger sign. This girl is a singer. MS3 vein, the girl is a singer, so Gressinger sign. Sigmoid sinus forms a jugular bulb, elopes with inferior petrosal sinus, goes outside the jugular foramen, marries and becomes internal jugular vein. Okay, so that's the anatomy of dural venous sinuses. After understanding the anatomy of middle ear and mastoid, let us now discuss the contents of middle ear. Okay, so now we are going to discuss the contents of middle ear. So you see, middle ear, it has, number one, it has two muscles, right? And number two, it has three ossicles. So we have already talked about these things. So let's go through them once again. So what all muscles are there in the middle ear? Number one, we can see over here, we have the tensor tympani muscle. Okay, so we talked about the tensor tympani right from the embryology. This tensor tympani muscle is a muscle of first arch, mandibular arch, right? Okay, so remember there were two tensor muscles, tensor tympani and tensor villi palatini. Okay, both these muscles are somehow related to eustachian tube also. You see, this muscle, tensor tympani, is just above the eustachian tube. Okay, tensor villi palatini, I will be discussing in the next topic of eustachian tube. Right, so this tensor tympani is a muscle of first arch. So obviously it will be supplied by which nerve? It is supplied by your mandibular nerve. Right? Okay, now you see this muscle, it arises from the canal of tensor tympani. Okay, so that's in the anterior wall, canal of tensor tympani, comes into the middle ear, goes to the medial wall. Now on the medial wall, we know it has a hook-like structure. The medial wall has a hook-like structure. We call that as processus cochleariformis. Right? So it hooks around this processus cochleariformis, takes a turn and goes and attaches to the handle of malleus. Right? So this is our first muscle, tensor tympani. The second muscle is the stapedius. Okay, so you can see over here that this, we can see the stapes, the smallest bone, and we know the stapedius, that is the smallest named muscle in the body. Right? So you can see the stapedius over here. Now this stapedius, if you remember, we have again talked about it in the embryology. This is a muscle of second arch. Right? Stapedius arises from pyramid, posterior wall. We have already discussed it. Okay, arises from pyramid, inserts on neck of stapes over here. Okay, right. So that is your second muscle, stapedius. Now we have three ossicles. So what are the three ossicles do we have? We have the malleus, incus and stapes. Now we have already talked about malleus, incus, stapes, the three ossicles in the embryology. So what all we have talked about in the embryology? That these three ossicles, malleus, incus, stapes, now out of them, malleus and incus, they develop from first arch. Okay, so we know they develop from first arch. Which cartilage? Meckel's cartilage. Okay, so first arch, mandibular arch, and we have the Meckel's cartilage, right? And then the stapes, it develops from second arch. Which cartilage? Rickett's cartilage, right? So it develops from Rickett's cartilage. Remember, except the medial surface of stapes footplate. Now the medial surface of stapes footplate, it develops from otic capsule. Right? So this medial surface of stapes footplate, it develops from otic capsule. Otic capsule is the embryological cartilaginous framework that forms the bony labyrinth. Okay, it is derived from secondary mesoderm, neural crest cells. All right. Now, Let's do some more embryological questions over here. You see these three ossicles, Malleus, Incus, Stapes, they achieve adult size. So if this question is asked, when do they reach adult size? So the answer is 15 weeks of intrauterine life. Okay, so they reach adult size by 15 weeks of intrauterine life. So that means if somebody asks whether they are adult size at birth, yes, they are adult size at birth because they have reached adult size much before birth. Okay, now when do they reach adult configuration? Now you see they reach adult configuration by 20 weeks of intrauterine life. Okay, right. Now over here we can also discuss about organ of Corti. So what is organ of Corti? Organ of Corti is a sensory organ for cochlea. Now this organ of Corti, it starts hearing, this question is asked in the exam, it starts hearing by 20 weeks of intrauterine life. Okay, organ of Corti starts hearing by 20 weeks of intrauterine life. Remember Abhimanyu. So we have this story Mahabharata. So in that we know Abhimanyu, he learns war technique while he was still in utero. Okay, so we have all heard that story. So remember, a child in utero can hear after 20 weeks of intrauterine life. Okay, so this organ of Corti, now we have scientifically proven it that we can hear after 20 weeks of intrauterine life. Now the next, this organ of Corti, it attains adult configuration. So starts hearing at 20 weeks and adult configuration at 25 weeks of intrauterine life. Right? Okay, so that was some more embryological question. Now a question is asked in your exam. The question that is asked is structures which are adult size at birth. Okay, structures which are adult size at birth. So what all structures are adult size at birth? Now we have just seen the three ossicles. Okay, Malleus, Incus and Stapes. All these three ossicles we have just seen will be adult size. Now you see, they have achieved adult size much before birth. They have not achieved it at birth, but they are of course adult size at birth. All right. Okay. Next, what else is adult size at birth? The mastoid antrum. All right. This I told you. The mastoid process is not present, but the mastoid antrum is present and is adult size at birth. Okay. What else is adult size? You see the ossicles. Where are the ossicles? The ossicles are in the middle ear. They are of having adult size and adult configuration. So therefore, middle ear, tympanic cavity is also adult size at birth. Okay. What else? Cochlea. Or I can say the labyrinth. You see, the labyrinth, complete labyrinth, the cochlea, the vestibule, the semicircular canals. So all these all these three they contribute and they are now known as labyrinth. So the labyrinth, the inner ear, it is again adult size at birth. Remember, the cochlea is sensory organ, organ of Corti. So organ of Corti achieves adult configuration. So adult configuration by 25 weeks. So that means the cochlea is fully developed. So not just cochlea, the whole labyrinth is fully developed at birth. Okay, so the question is asked in the exam, which of these structures is not of adult size at birth? So not of adult size at birth. Now for that you have to remember that we have talked about these. Remember, don't confuse the antrum with another antrum. So in the nose topic, we will be studying maxillary antrum. Okay, over here I have taught you mastoid antrum. Now don't confuse antrum with antrum. Why? Because the maxillary antrum, it grows after birth. Okay, so this will not be adult size at birth. It grows after birth. Right? Okay, anything else? Orbital cavity. Your orbital cavity. Again, this grows after birth. All right. So these are the choices that are given in the question. So these are not of adult size. The mastoid process. Of course, mastoid process is not even present. We already have discussed that it appears 6 months after age and it grows till 18 to 19 years of age. So that is also not of adult size at birth. Right? Okay, let's look at these three ossicles, malleus, incus, stapes. The next question on them. Now, the joint between these three ossicles, malleus, incus, stapes. So, the joint between the three ossicles is synovial joint. So, which joint? We have synovial joint. So, somebody asks you joint between ossicles, answer is synovial joint. Somebody goes to a specific question that joint between malleus and incus. Okay, now if somebody asks a specific question, then you have to give a specific answer. Okay, this is saddle variety of synovial joint. All right, so now if somebody asks you the type of joint between incus and stapes, so now that joint is ball and socket variety of synovial joint. Okay, so you get it. If you mark synovial joint, it may be a wrong answer. Why? Because the examiner give a better choice as ball and socket joint. So please see, synovial joint is a correct answer, but ball and socket joint may be a better answer. So if you mark only synovial joint option, you may have a wrong option marked. You have to always choose the best option in the question. All right. So if specific question is asked, go for specific answer. All right. Now the next, let's discuss the parts of these ossicles. Okay, so parts of these ossicles, malleus we have already discussed earlier with the tympanic membrane. Let's revise them. So what are the parts? We have a head. Now below the head we have a short neck. Then now after the neck we have the lateral process of malleus. Now lateral process of malleus, remember we discussed this is the most reliable landmark of malleus. Okay, now near the lateral process we also have a short anterior process. All right, now then we have the handle. Handle is also known as manubrium. Okay, and the tip of this handle of malleus is known as umbo. So I will taught you umbo. Umbo is the most visible or anatomical landmark of tympanic membrane. With this umbo, we are able to divide the tympanic membrane into 4 quadrants. The pars tensa is divided into 4 quadrants: anterior superior, anterior inferior, posterior inferior, and posterior superior. All right. Okay, let's come to incus. So what are the parts of incus? Incus, we have the body. So you can see over here body, and from body we have coming out the short process of incus. Okay, right? And then we have the long process of incus. The long process ends with a small lenticular process of incus. Okay, now over here, if I take a cross section at this place, okay, if I take a axial cross section at this place like this, so I'm cutting it like this. Okay, if I take a axial cross section like this, so you can see that my cross section will show me ossicles in the form of ice cream cone. Okay, so you can see that I will have in this ossicles appear to me in the form of an ice cream cone. Now here the ice cream is formed by head of malleus. Okay, and the softy cone appearance is given by the body and short process of incus. Okay, this ice cream cone appearance is seen in the CT scan of the temporal bone, axial cross sections, and we have actually seen this ice cream cone appearance when we saw the CT scan right in the embryology, where I discussed the CT scan of the temporal bone with you, and I showed you this ice cream cone appearance both on the left side as well as the right side. Right? Okay, so this was just a revision of that ice cream cone appearance. Now let's come to parts of stapes. Stapes part I have already discussed with you. So what are part of stapes? There is a head. After the head there is a very short neck over here. Okay, so we just saw on this neck, previously we just saw is attached the stapedius muscle, and then we have two cruras, anterior crura and posterior crura, and then we have the stapes foot plate. Okay, so these are the parts of the ossicles. Now the important question that come from these parts: The important question that comes is that this ossicular chain, it's a chain. The three ossicles are combined together, so they form a chain. Now, they start undergoing erosion. Okay, so these ossicles, they start undergoing erosion. Now, whenever there is a chronic disease, okay, long-standing infection that can cause necrosis and erosion. Now, which is the most common part or the first to undergo erosion? The first to undergo erosion is lenticular process of incus. So remember, if there is a chronic disease, there is a chronic infection, long-standing infection, now that can cause erosion, and the first part to undergo erosion is lenticular process of incus. Now, why is it undergoing erosion? Now, earlier it was believed that that is because of the tortuous blood supply, but now we know that the main reason for erosion is delicate structure. Okay, so delicate structure is the most important reason for erosion, lenticular process of incus. This is the first to undergo erosion. Okay, lenticular process, part of incus. Now, if this lenticular process is not given in your exam, so you know many a times in the undergraduate exams, for undergraduates, they skip the lenticular process. So if that is not there, then remember, second to undergo erosion is long process of incus. Okay, so long process of incus, you have to mark if lenticular process is not given in the exam. And you know, in a race, the first and second person may be important, but the most important person then again is also the last person. Okay, so which is the last to undergo erosion? When whole of this ossicular chain is eroded, which is the last man standing? Okay, so the last person or the last piece of this ossicular chain to remain is the foot plate of stapes. This is the last to undergo erosion. Just remember, the foot plate is also contributed by otic capsule. Otic capsule forms the strongest bone in the body. Okay, so therefore, of course, foot plate is the last to undergo erosion. Okay, right. So this was the ossicular chain, okay, contents of the middle ear.